here today. We have our whiteboard, and then there's some markers and other stuff. All right. Basically, we just want you guys to understand some of the contents we talk about. It's mostly we use medical terms, health terms, and all of that. This time around, we want you guys to be able to relate to whatever we say. So some of these things we are going to put them on this board, especially some of the terms, so that you can relate and then go along with us. All right, and this is basically going to be a content on conditions, on health conditions. So basically, as you can see on the board, I've written, I don't know whether this is bold or big. All right, on the board, PUD. I mean, day in, day out, people go to hospitals and then they are being told you have PUD, you have this, you have that, and then the understanding is very far from that particular person. All right, so when we say PUD, just basically means what? Peptic ulcer disease. So today, that is what we want to understand. But like I've always been saying, um, some of the terms are very difficult to understand if you are not health inclined. So basically, I'm not going to go into very much details of it. I just want us to understand and know how we go about it. All right, so like we used to do on the card system, I'm first of all going to introduce you to the topic, and then I'll talk about the possible causes. Then basically, I'll talk about the risk factors associated with it and all of that, as you can see. Then we talk about the presentation. That's the signs and symptoms of the particular condition. That's for today, peptic ulcer disease. Then the most important part of it for me is this one, the preventive what measures against this particular condition. All right, enough of the too much talk. Okay, so when we say peptic ulcer disease, or when we say ulcer, ulcer just means a sore. All right, a sore at which place? It can be a sore at any part of the body, but this particular time we are focusing on what? The digestive tract. That's basically where we are going to focus on today. And with the digestive tract, we are basically focusing on what? Two sides. We are focusing on the stomach, and then the first part of what? The small intestine. That's what? The duodenum. Like I said, I'm not going to go into so much detail, so everyone should be able to follow. I mean, it's not difficult knowing what the stomach is and then knowing what the duodenum too is. All right, so basically these are the two parts we are going to focus on when we take the digestive tract. Like I said, ulcer just means what? When you say ulcer, it just means store. I mean, a crow. So you can have also of the scalp, you can have also of the leg, you can have also of the skin, you can any part of the body at all. But like I said, we're going to focus on the stomach and then the duodenum. All right. So what I want you to understand is that God made the body in such a way that it can protect itself. All right. So the stomach and then the small intestines or the duodenum has a lining that protects it, and this lining regenerates. The regeneration of this lining is triggered by substances. All right. So in short, or in simple terms, the lining of the stomach has a protective what? Cover. So this protective cover prevents it from what? From from the acid it produces. I mean, when you take the stomach is an acidic environment. It produces a lot of acid, especially when it sees food. All right. But then for the acid not to burn the stomach and then turn it into salt, it has a very protective layer. It which helps it to go against the degrading effect of the acid. So this protective layer is there. The moment this protective layer is damaged or is degraded, that is where it more like, I mean, when you pour acid on someone, what does it do? It burns the person. So if that person doesn't have a protective layer, that's more like a cover. It's basically going to burn the person, right? So that's what the stomach environment is about, and the acid. So the moment the acid pours on the lining of the stomach, and then there is no protective layer. It burns you, so the person begins to what, feel pain, or what, a sore is created, or a wound is what created there, and basically we have what you call what, the ulcer. So yeah, that's just the intro. When it comes to, and these things can be caused by so many factors. Like I said, I'm not going to go into much details. This thing can be caused by so many factors. One of the most common factor was what we call the H. pylori. So mostly, I know a lot of you guys have gone to hospitals, and then your doctors might have told you that go and do H. pylori test or go and do ulcer test. And this is basically what it is. There is an organism, a bacteria that causes degrade or that degrades what, the stomach lining. It has the capacity, it has the ability to what, to damage the protective layer of the what, of the stomach, and also what, the first part of the small intestine, that is the duodenum. So in so doing, it exposes the surface of the stomach to what, to direct impact from the what, from the acid. So at the end of the day, it bends you, then it creates a sore. So what, H. pylori. Then we talk about medications or drugs. I'm not going to go into too much of it. Example, NSAIDs. I mean, most of us might not understand what NSAIDs are, but NSAIDs are basically common ones. Are, let me say NSAIDs, non-steroidal anti-inflammatory drugs. Commonly, we have diclofenac, we have ibuprofen, all of these ones, right, will expose your, or will damage the protective layer of what, of the stomach, and then expose you to what, to the greater impact of what, the acid. So at the end of the day, you're also going to experience the effect of it, the ulcer effect of it. Then we have steroids. Steroids also does same. It's also prevent the protective layer from even forming at all. So at the end of the day, you expose yourself, or exposes the stomach or mucosa to it, or stomach lining to it. And all these things are going to occur. I mean, imagine, like I was saying earlier on, an acid is poured onto you. You don't have any protective layer. What is it going to do? It's going to burn you. So basically, that's what it's going to do. So if you don't have all these protective layers, if you are doing something, or if you are taking in something that is going to prevent this protective layer from forming, or that is going to prevent the activities of this protective layer, basically you are going to develop a sore. And that sore is basically what you are going to term as what? Ulcer. Now we are going to talk about the very thing we can, I mean, we can all stop buying these things, right? If you are known to be someone who buys a lot of painkillers from various drugstores and pharmacies just because you have a certain level of pain you can contain, probably you put a stop to it, or you reduce the frequency at which you buy those medications. Steroids are to, I mean, most ladies, now it's very common. Most ladies use, especially those who want to become big. I mean, for all kinds of things, you might probably not even be aware the kind of things they think they are taking the steroids for. But then it predisposes a lot of them to what? To peptic ulcer disease. Now let's come to the H. pylori. Now, the clue here is that the fact that someone has tested positive for H. pylori doesn't necessarily warrant that the person has what, ulcer. Nah, it doesn't go that way. But then it's just that it has a very high association with what, peptic ulcer disease. Now, the moment you test positive for H. pylori, the treatment for you is going to be different from the usual treatment for what, ulcer. All right, so I mean, there's a controversy here about its transmission. Some studies say you can get it from contaminated food, that's fecal oral contamination, where maybe you contaminate your food with feces and all of that. Some studies also say you can get it from kissing, that's saliva contact. You can get it from kissing, you can get it from sharing utensils at home and all of that, spoons and all of that. So these are some of the ways you can contract H. pylori. But like I said, the fact that you have tested positive, or one has tested positive for H. pylori, doesn't necessarily mean the person has ulcer. It just means that you are at a higher risk of getting ulcer, because it will take time for the H. pylori to what, to degrade. And at the end of the day, you have someone who has contracted H. pylori, and at the same time the person is on what, NSAIDs or what, steroids. You realize that this person is at a greater risk to someone who has just had the organism, yet is not on this, is not on that. The person is not starving him or herself. The person is not, all of those things the person is not doing. So at the end of the day, you realize the person who has the H. pylori and the one who is basically abusing NSAIDs and steroids stands a higher risk of what getting the peptic ulcer disease. So that's basically it. So how to prevent this particular thing? You basically need to like practice personal hygiene in terms of fecal contamination for kissing and then sharing of utensils. I don't know how I'm going to tell you to prevent it. Yeah, so if you have other ways to prevent it, that's fine. But with that, I don't know how I'm going to tell you to prevent it. Also, if you are the type who is used to abusing NCs, especially people who do in this particular work that demands a lot of energy and all of that, you get wasted, your body get wasted, you go through a lot of muscle pains and all of that. So you always be tempted to get what? NSAIDs. Like I said, the common ones, ibuprofen, what you call brufen, what commonly you guys call ibuprofen, and then diclofenac. You have them in Jebedor, which one again? Common one. Yeah, we have Jebedor, common one people usually get. And then steroids. Steroids, you have what? Commonly prednisolone. That's the common one out there. Prednisolone, you have. Those are the oral. So the injections is highly possible that you are easily going to get. Alright, so this is it. So if you're able to prevent yourself from this, also people are advised not to take in certain foods when it comes to what as far as ulcer is concerned, especially the acidic foods and all of that. It's not that those ones will cause the ulcer, though, but then it can trigger you, especially someone wakes up in the morning, the person doesn't eat anything, and basically see the person drinking orange or something. Come on. See, the stomach is such a place that the moment it senses even the aroma of food, the digestive enzymes will be triggered. You understand? When you sense the aroma of something nice, a food that is really nice, you begin to produce saliva. Those are digestive enzymes in the saliva. And they are expecting something to happen. So basically, you really need to study the way you eat. Try to dilute the stomach environment before you try to even take it. In as much as you also want to prevent that, this food also need acid to what? To undergo digestion very well. So basically, when you are doing these things, you should be careful. If you haven't taken in anything better, don't try taking in these acidic foods and all of that. It wouldn't help. Make sure you've taken in something good, then you can take that as a top up or something. All right. And then again, what are some of the things people are advised not to do again? Starvation, fasting, and all of that. We all believe in God, you understand. If you know you have been diagnosed with a particular condition, and then, per your faith, you say you do the fasting. Sometimes, come on. In as much as we fight the spiritual side, we should also fight the physical side as well. So at least you should consider certain things before you indulge in activities such as that. But then other studies will also tell you that it has a very fasting also has a very lower risk in that. Well, in medicine, it's just like never say never. Anything at all is capable of happening. All right, so that is it. So basically, we've gone through I've been able to introduce you to the condition that's peptic ulcer, and then um, the causes, the risk factors, and then the preventive measures. Now, this particular disease, peptic ulcer, is basically two types. It means you have the two types of the ulcer. So we have the uh, gastric, that's the one with the stomach, gastric ulcer, and then the duodenal ulcer, like I said. When you have these two, it means we have what? Peptic ulcer disease. Now let me give you a trick here to know which of these two that you are suffering from. This is my last point, then I conclude. The stomach is an acidic environment. When you take the small intestine, the first part of the small intestine, it's only a particular portion that acid can get up to. We call it the first part of the what? Of the duodenum. All right. Now, if you eat, like I was saying, the moment you eat, acid has to be produced to help digestion. So some people will come and say that when I eat, I feel pain in my tummy. I mean, it basically means you have what? Gastric ulcer. Because the moment the food gets the acid will be produced. Then others will come. When I starve myself small, then I feel the pain. Now it means that the food has been able to get into the stomach. Now there is no sore, so it's not paining you. The sore is at the duodenal point. So the moment digestion has taken place and all of that, it means you're basically going to get hungry again. So you stay a particular time and then the food has to move down. So you starve yourself a bit. Acid, there is no food in your tummy. Acid get produced, and at the end of the day, some of the acid is transported to the side of the duodenum. That is what affected. Then you feel the pain. So these people, those with gastric ulcer are going to come with when I eat there is pain. Those with duodenal ulcer are going to come with when I don't eat or when I starve myself small, I feel pain. So and another thing is that because those with gastric ulcer, because when they eat, they feel the pain, they stay away from food, so they are mostly slim. That's one key thing you can find. They basically run away from food, so they will come when I eat there is pain, so I can't eat. So they are mostly slim. But they didn't know I can't I can't tell for them. All right, so that's basically it. Stay away from painkiller abuse. Stay away from steroid abuse. Try to eat well, eat on time, and then try not to eat contaminated food. That's all for what peptic ulcer disease for today. Another time we'll move on to another condition. So stay tuned. This is O.M.A Medicals today. Thank you.